So Fran, if you're on, you could have your slides pulled up. That would be great. You good, Fran? Thanks.
I got to unmute myself in 50 million places here. Yes, I'm good.
Thank you. Good to see you today.
I'm in the wrong place.
Who was that?
Maria.
Maria, you are in Colorado and the Arizona room.
Yeah. So I'm good in here, or should I need to do something? This is so.
Is this the room that you wanted to be in?
The number, that's the one. Yeah.
Yep,
Because Jesus is gonna switch to the other one.
Jesus is gonna switch to the other one. Okay.
Yeah.
Yep,
Number
no
2.
problem.
So I'm okay here.
You're good.
Okay.
We love to have you here.
Okay. Thank you.
No problem.
Christy? Hi, it's Sandy.
Hi, Sandy. How are you?
Hi. Good. How are you?
Good.
Good.
You're up in session 2.
Okay.
So you're going to be not this session. We're going to but later on you'll be presenting in State Team Breakout 2 in room 2.
Okay. Okay.
So you're good.
And where am I right now? Am I here?
Right now you're going to listen in to Colorado and Arizona in room 1.
Okay, perfect. So I just stay here.
You're good. Yep. You were teleported here.
Okay. Good. Thank you. Thank
You
you.
don't have to do anything else, anything for anyone who hasn't done breakout rooms before. You're just going to go back to the main room when this is all over. If everybody looks in the top right-hand corner, you'll see a little timer. And when that expires, when that counts down to 0, we'll all just be teleported back into the main room all together.
Okay.
It's so much fun. All right, we'll give everybody just a minute more to come back in, and then Erica, I have just a couple of announcements at the top of the hour, and then I'll turn it over to you. All righty, we're almost at the top of the hour. Just a few more seconds. So I'm just going to remind everybody that we're going to use the chat box again for all questions and comments for the speakers. So please use that throughout the conversation or throughout this presentations. And those will be read by the facilitators after both presentations are complete. So with that, we are going to get started with Colorado. So up first, we have Erica Wright, who will be presenting for Colorado. And Erica will have 7 minutes to present. Erica, I'll give you a verbal 2-minute warning. And then when you wrap up, then we'll switch over to Fran in Arizona, and then we'll do questions and answers at the end. So you're up.
Good,
You're up.
Christy. Thank you all. Excited to virtually see you all today. I'm going to be giving the update regarding our Colorado team. Feel free to ask any questions, I guess, via the chat box. And then I will turn it over to Fran, who I hope doesn't outdo me after I present. So one of the tasks that we were asked to do was to just give some updates regarding where our membership stands for Team Colorado. We have had some changes in recent months with some new members of the team joining us, as well as some members of the team. Stefan Mokahiski finally really officially retired, so we had to say goodbye to him this year. But Jamie, who's been a longstanding member of our team, is a new co-lead with me. Jamie's a consumer. And part of our team, kind of the veteran members, include Tracy, Janet Thomas, Maria and Jesus Castillo, and Heather, who works as a consumer with Miracles for Mito. We were really, though, able to focus on expanding the team and getting some additional consumers as well as some additional providers within the community. So we just welcomed Brittany Park. She got her feet wet last year doing an event with us in the spring. Mariah is new to our team too, and she runs an organization called The Lightning in Love. Dr. Patrick Long is a trained family practice physician, but is currently a third-year biochemical genetics fellow with us at Children's Hospital. And he's here today as well. Dr. Dewis is one of our new geneticists. She's new to our region, but works a ton at Children's Hospital during this last year with a focus of a number of disorders, and brings also knowledge of kind of coming from another region. Dr. Robin Nolan is a developmental pediatrician at Kaiser, and then Dr. Christine Jelinek is also a pediatrician at Kaiser that actually helps facilitate all of our genetic testing recommendations at Kaiser. So with that being said, what our goals have been that we've accomplished to date as well as moving forward. Last year, we continued our virtual education series. This was a monthly genetics education series that really was a partnership with the Children's Hospital telehealth team. It was a wonderful partnership because the telehealth team took care of all the logistics, a lot of the advertising and promoting of the events with pediatricians and family practice providers around our state. And we had monthly 1-hour webinars, also known as Genetic Tuesdays, that we launched. With COVID, we had to take a little bit of a break, recognizing that many primary care providers were dealing with bigger issues in the spring, but thankfully we were able to ramp it back up thereafter. And with Christy's help and doing some additional promoting, we had participants from around our region as well as around the country, truthfully. And some of the topics that we focused on were just a general overview of things like genetic testing and referrals to genetics and genetic counseling. And then we were able to focus on some common indications for referrals to genetics and some of the more common disorders that we see. Things like NF1, findings, cardiac defects. So we were able to really ask and get a number of providers to have their expertise. I don't know if we ever broke 50, but it was not uncommon to have anywhere from 30 to 40 participants each month join us with some repeats, which was wonderful. One of the barriers that has come up and that we're feeling a little bit sad about, as just as our team was about to roll out 2021's schedule, our partners at the Children's Hospital telehealth team, the main person took a different position. And so now we're rethinking how to continue this education series, whether or not monthly is feasible, and what types of support we need maybe from THI to facilitate that. Maybe we can at least get a quarterly series going again. And so right now, unfortunately, there's a bit of a pause in that activity, which is unfortunate for us because, again, we were really getting some increasing number of participants in the fall. If anyone's interested in viewing any of these educational 1-hour seminars, they are all uploaded on the Mountain States website for continued viewing. And so at the very least, they will live there for a possibly eternity, but they can be a great resource to provide to other providers in your neck of woods and other things. So in moving forward, what we were planning to do is actually to focus a little bit on some roadmaps. A ton of resources to our state team website, but recognize that maybe they're not easy to navigate as a new family or a new consumer. And we also want to take that project one step further and really work on having a roadmap, a bit of a living document with links that families can utilize to think about that transition. One of the ideas our team is working on is really doing it by birthday cake. So each year or each sets of years, what goals families need to think about in achieving transition, and then hopefully having the resources all in one place that they can navigate that very difficult process a little easier. Our collective experiences as a team. So really this last grant cycle and continuing forward is that it's the collective experiences of our team that drive us to what our goals and destinations are. I thought of some driving analogies when putting together this slide last week. So we continue to keep looking ahead, but also remember to look in our rear view mirrors to get some different perspectives and focus on some of our lessons learned. And when we think about our virtual education series, just when we think we're on cruise control, we hit an unexpected bump or roadblock, and sometimes we have to think about a different route to our destination. Lastly, for our Time for Genetics clinics and locations, we've run into some barriers with some providers in our region willing to do the Time for Genetics. Having Patrick Long join our team, he's worked extensively in our state with some family practice residency programs. So it's a different twist on the Time for Genetics clinics, but rather it might be a really interesting way to think about it. So there's 11 programs across our state that are training family practice providers. And with that being said, it's a 3-year program, which gives about 12 to 30 individuals per program. And these programs are really geared for caring for patients and families throughout their lifespan, but often in the underserved areas. So rural communities, urban communities, maybe community health programs. So with that being said, by targeting family practice residency, we really will be capturing those underserved communities. And the hope would be if we can give them some additional genetics training early on before they even enter their career, that they will bring that forward to hopefully our region. But at the very least, get some additional genetics experience under their belt so that they can move forward when they are practicing in the community and have a better understanding of genetics. Okay.
Hi. Good job. Thank you, Erica. Appreciate it. And again, if you have any questions at all for Erica on what she just presented, pop them in the chat. And with that, I will introduce Fran Altmeyer, our co-lead with Kathy Lewandowski. Fran will be presenting today for Arizona. So I'll let you go ahead and share your screen, Fran, and take it away.
There, I unmuted myself, I think. Can you all see my screen? Okay, good. So good morning. Like Christy said, Kathy and I have been the co-leads for the last grant cycle, and for this grant cycle, we have Dawn Bailey, Ashley Boruff, and Wendy O'Donnell, who continue on our team. But the exciting part is we have so many new team members this grant cycle. We were really excited to sort of expand our reach of participants in our state team. So we have a list here of our new team members. We have Christopher Tiffany, who's the executive director for Raising Special Kids, which is Arizona's parent-to-parent organization. So he and Kelly Randall from his team are a wonderful addition. We have Dr. Sydney Rice, who's a developmental behavioral pediatrician, and she, I think, had been on the team many years ago and has rejoined, which is great. We have Dr. Teresa Grebe and her genetic counselor, Supraja Prakash, who've been another addition to our team. I think Dr. Grebe was on it a long time ago and now is back. And for the most part, her genetic counselor, Supraja, has participated in a lot of our meetings and has just given us a whole wealth of information on genetic counseling perspective, which is a gap that we've had for many years. So we were excited for that. And then also we really wanted to try and increase our focus on sickle cell. So we were glad to have Edie Smith as a parent join our team as well. And she's a parent of a child who has sickle cell disease. So our state team activities to date, we are working on creating a telegenetics brochure. We, over the course of our first few months in conversations and the whole switch to telemedicine, one of the things that came up was a gap in information for families on what to expect from a telegenetics visit, especially a visit where it's typically a very hands-on visit. How can families appropriately prepare for that visit, know what to expect? And so we have a small work group that is working on creating that brochure. Early intervention video project is our very newest endeavor that we're hoping to ramp up pretty quickly. But just early intervention in our state and probably in others because of the tele-intervention, they've had lower enrollment. And so we thought if we created a series of small videos for families to know what to expect from a tele-intervention visit. What does that look like? My baby needs physical therapy. How do you do that from through remote? So tips and tricks, having families who are doing tele-intervention really show what it's like and how they're able to participate and learn from these televisits. So that's our newest project. Utilizing our state funds, we're still trying to figure that out. It will likely be for printing brochures, perhaps compensating some of our parents and families who are participating in our video making. The other activity we've been working on is updating our website. So we're working on making sure that our information up there is accurate and robust enough to really support a family who accesses the website for real-time information. So our experiences, again, I think I already touched on this, that we really have more interest than we've had in the past, which is super exciting for us. The increased participant diversity, our conversations, you know, it almost feels like Kathy and I were talking one day that some of our state team meetings seem to just lack a lot of motivation. And I think every state team meeting we've had in the past 6 months seem to be very engaging, robust conversation, almost fills up the time to the very end. So for us, that was really encouraging. We've learned a lot about genetic counseling. We had the genetic counseling program from the University of Arizona participating in a couple of calls, just sharing what they're learning. I know that they have been working on doing some genetic pop-ups. So that's been really good, and just new ideas, fresh ideas, and that's always good. You know, some of us have done this for a long time, and you know, or we have a narrow focus. You know, newborn screening was a focus for many, many years, and that's really what I do. So to have other people participating and sharing in the collaboration has been really beneficial.
2 minutes left.
All right, our time for genetics clinic is going to be North Country Healthcare in Northern Arizona, which again, you can see sort of this map of our state, the whole top half there. A lot of that is very, very remote country, very rural. It's based out of Flagstaff, but I think it has the ability, being a healthcare network, that we will be able to reach a lot of these underserved communities. And we had lots of interest in it. So really narrowing down where to start was probably our toughest thing, which I think is a good thing, that as this rolls out over the course of the next several years, we will have plenty of participation with providers. And that's it for Arizona.
You finished early. Good
All
job.
right, talk fast.
Thank you. Thank you, Fran. All right, I will pause my timer. And with that, we have the balance of the time, which looks like about 14 minutes for some question and answer and some conversation. So I've got one comment that's come up from Dale. Rather than reinventing the wheel, how can we share genetic resources that each state has developed, such as educational materials, videos, and brochures? Thanks, Dale. Great suggestion, Dale, and I'll let Erica and Fran chime in if you have any ideas on that. Because those videos sound pretty awesome.
Yeah, we're excited. So it just came up as actually a topic in our last state team calls. So it's in the very early stages, but we're really hoping to ramp it up quickly because we want to increase, you know, participation in early intervention services. We don't want kids missing out on you know, that very important early time frame for intervention.
Great, thanks. And Erica, I know one way that you kind of have addressed the stuff that Dale's talking about of the videos is archiving those on the Mountain States website. So that is a living, breathing place where people can continue to watch that great content.
And I think, Christy, you've always done a wonderful job of in the newsletters, just reminding people what those resources are, or if something new has been posted. So it's just a good reminder for all of us to occasionally check out the Mountain States website and toggle around and find hopefully some things you can bring back to your state team.
And I'm going to put in a little plug for a speaker in a little bit, which is Megan Lyon from National Coordinating Center. She's going to do a demo on something called Resource Repository, and all of our stuff that we make within Mountain States and all of the other regional genetics networks, we dump into that resource, and she's going to show us how we can comb through that resource to see if something has already been made. And I told her she should rename her talk, How Not to Reinvent the Wheel. So there you go, Dale. Coming soon. Stay tuned. We have another comment from Brittany. I love the idea of early intervention videos. I agree. Does anyone else have any questions they'd like to pop in there, or comments or conversations? They maybe want to know some more details for like Erica on how they even set up the virtual education series, who they talked to, or Fran on how they're making those telehealth resources. I know, Fran, I remember one of the calls you guys did a smaller work group to kind of start working on some of that, and that seemed to be really helpful and work for you all.
Yes, and actually we still haven't reconvened. I think the holidays hit and COVID in Arizona has been crazy. So I think everybody's been stretched pretty thin. So we're in the process of revisiting that and with our work group, because we want to get that out sooner than later.
And Erica, you guys have taken a similar model just recently on the transition work that you're doing. And Ivy just popped a comment in there. I'd like to hear more about Colorado's work focused on transition. So maybe if you can expound on that.
We've just started it kind of late in the fall of just collecting resources. I think there's so many things out there, but we really want to make sure that all the pieces of it are fitting together for our families, the educational piece at transition, the medical piece, the legal piece. And so thankfully with our consumers as part of our work team, everybody has a lot of knowledge as far as the resources in the community. We're just trying to do a better job of putting those together so that families have an easier time navigating. And really thinking as we brainstorm, we are going to do kind of Arizona's model of a bit of a smaller work group. And also we were brainstorming about getting some free labor, or maybe utilizing some of our state teams for things like translation of those materials, but really trying to think of, for instance, we get a lot of inquiries from potential genetic counseling students looking for a project or some type of summer intern, and how we could utilize them to help us better organize it, since everybody on our team is busy. And so we just all try to put our efforts together. But in the end, sometimes we just need, maybe, as I said, a savvy tech creative student who could come along and put that all together for us. So Ivy, we're just in the beginning stages of it, is basically the long-winded answer to that question.
Thank you. I think you're looking for a younger Christy.
Yes, is that possible? I think not.
Oh, you guys, stop making me blush.
Doesn't have to be younger, just a clone.
We are in the genetics business. We should be able to do that. All right. So Dale has another one. He popped in here. Could we develop a network for providing genetical clinical services such as initial evaluation and follow-up, particularly when there are significant delays in receiving those services in states with limited provider resources? So Fran or Erica, do you want to take that one, or Dale, do you want to, do you have some ideas on this? Do you want to pipe in?
Well, I'll just mention in New Mexico, we've had some families with some particular disorders or possible genetic disorders that have to wait up to a year. We had one situation where someone said the next appointment was 3 years from now. That's just unconscionable. So my sense is we have the Mountain States network. And is there a way we could develop a system in which when a state does not have the necessary resources to do timely interventions, where we could use others from other states and allow that to happen, such as Colorado or Arizona, that may have more resources than we have here in New Mexico. For instance, we only have one geneticist in New Mexico and only a couple of counselors. So it's a real problem for families. And it seems like we have a lot of resources if we could share them, even for clinical services. Now, I realize there's certain things we'd have to address, like interstate licensure, what have you, but it would be great if we could work on that problem, because for some states, and I would imagine others face the same thing, we just don't have enough resources to provide services in a timely manner.
Dale, I think
Thank you, Dale. Go
Mountain,
ahead, Erica.
Mountain States has taken a few stabs at not some pretty great efforts of developing some algorithms to share with those primary care providers so they can maybe think about getting the ball rolling for evaluation, but that only takes you too far. While telehealth seems like a great answer, unfortunately for us, where we've struggled has been the licensing to other states, and that is even a problem for genetic counselors. If another state has licensure, we haven't been able to practice in that state, and unfortunately the telehealth goes back to in the family's home. So and insurance becomes the other big barrier. So there's some big things we'd have to think about, but I agree that in our state, we have these hubs that are very strong with a number of geneticists. And then there's other vast regions that are just covered by one geneticist and maybe a handful of counselors.
And I'm thinking too of kind of the model, the telegenetic model that Colorado has done with Tuba City and the last grant cycle. That's telegenetics across state lines, right? So maybe something like that. I know there was a lot of contract negotiation that went into being able to use that institutional credentialing, if I'm using the right terminology there. But that might be something to model to look at as well. And we've got a bunch coming through on GOT transition. I think Erica's group is well aware of all of those resources. So thank you everybody that's recommending GOT transition in the chat there. Sandy Whistler has a comment that PCPs can't order genetic testing such as microarrays. We've come across that as a barrier for sure with our rolling out of the developmental delay algorithm. Some can, some can't, depends on which state you're in, depends on which insurance sometimes, depends on what Medicaid covers in your state. And Ivy's says, just was curious in what ways Colorado was addressing transition, as that isn't something we've talked about specifically yet, or as best I know on our Texas team. And so I think you answered a little bit of that, Erica, but anything, you want to expand a little bit more on the birthday cake idea? I just love that Heather brought forward.
Sure. So in the world of our savvy families, which is a bulk of our consumers, to be honest, this transition period really starts early on. And I am blown away with how many steps there is for a successful transition to adulthood. And it's not just changing to a different care provider. There's so many aspects of that. So Heather had come up with the idea of really just benchmarking these checklists with the appropriate resources of saying, it's your 14th birthday, happy birthday. Here's things that a family should be starting to think about now versus waiting to 18 or 21. And so we thought from a roadmap idea or from a creative idea, that might be a nice way for the families to start thinking about it. And again, it's the families that might have no services in their lives, maybe aside from their IEP or their special education at the school, that really have to start understanding how long that process takes and just having some more resources to start thinking about that earlier, because you just can't get through the checklist easily anyway, but leaving it until kind of the last bit of that 18 to 21 is really overwhelming. So we thought by birthday cakes, we can tease it out a little bit.
Great. We've got some comments coming through. Eric, I think you might want to talk with the New Mexico folks. Kathy says they have done this at Pro for their New Mexico healthcare transition. Sandy said they had a great successful transition program that utilized telehealth. Ashley commented here, and broadly, we do see families here in Arizona, particularly those residing on the borders of the states within Navajo Nation, often travel across state lines for medical services. So that continuity of care and coordination is crucial and critical. And Jen Bana, I'm thinking that some states may need to look at changes in state laws or policies to increase access for consumers. In Montana, they are working to pass a law to give licensure genetic counselors so that they are recognized and can bill a different way to insurance. And we just have about 2 minutes left, so I'm trying to keep up with the comments. Keep them coming because these are all being recorded. So some more Arizona transition things. Ivy loves the birthday cake idea. Great discussion. And Dale says, perhaps we could form a working group to address the challenges in creating an MSRGN for providing genetic clinical services for low resource states. I think that's awesome, Dale. And I think we've talked, this concept of these, what do you call it? What do you call it, Dale? The genetic hubs, right? Having the genetic hubs really needs some more development and talk. So, or can we spearhead you? Can we tap you on the shoulder, Dale, to spearhead that? Dr. Marvel is Dr. Marvel the only geneticist in New Mexico right now? I believe that is correct.
Right. And, they're overwhelmed. They have 36 outreach clinics. And that's probably why Dr. Marble isn't on this call today.
Yeah.
And I think that many states would welcome the opportunity to get clinical services from other states. But we just, as Erica said, there are challenges in doing that. But I think they can be addressed and need to be addressed because it's just the right thing to do.
And you have a volunteer already. Patrick Long said he's willing to help.
Fantastic. Well, let's try to follow up on that after this conference today and see if we can form a group to address those issues. They're challenges for sure, but but we should be able to use telemedicine and telehealth as a vehicle to do that. So anyways, I'm looking forward to that. Thank you.
Thank you all. All right, 52 seconds left. In when the timer runs out, we will all be teleported back into the main room. So any final questions, thoughts, comments, gasps? If you have a gasp, don't put it in the comment here. Go and I'll put the Padlet link back in here if you want to click on that real quick and record your gasp from Colorado and Arizona. Right there, you can put a little sticky note up and record. Dale, capture your idea there. Put your gasp up there about your new work group that's forming. All right, thank you everyone so much for this breakout session. I kind of feel like it's speed dating today, so we will have another breakout session number 2 in a short while. But we're going to go back to the main session, and then we are going to hear from Liza on some evaluation and that resource repository presentation from Megan that is how not to reinvent the wheel. So see you back there.
To everyone still here, if you go to the bottom right corner of Zoom, you can hit leave room and that'll bring you back. It should kick us out automatically here.
Welcome, everyone. You are in the Texas and Utah room. Hi, Melissa. Everybody's coming in now. Thanks for joining us. You are in the Texas and Utah room. We will get started in about 5 minutes. So for Texas, if you guys can have your slides up, if you'd like to go ahead and share them, you can, so that people know they're in the right room. And then right about 4 minutes from now, we'll get started with Melissa, you and Daphne are both presenting.
It's mainly going to be me.
Okay.
Daphne's allergies are affecting her voice today.
Okay, no problem. Thank you for sharing. We can see it perfectly.
Good. If we have just a minute, you said, before we start?
We do. We have about
myself.
3 minutes. Go ahead.
Okay, I got myself some water and I left it in the other room. So
Perfect.
I will be right back.
Go grab it.
Let me check on Jesus, Christy.
No problem, Maria.
Okay, so I'm kind of not with it, but how do we post the gasps? I mean, I wrote one, but how do you get it to stick to the page?
So you just click somewhere outside of the white box that you typed in.
I can do that. Thank you.
No problem. Did it work? I'll go click over there and see if I can see it.
Daphne, I can see your gasp.
Ready when you are.
Thanks, Cody. Oh, Melissa's back. All righty.
Yes.
So I've got 2:18, so about 2 more minutes. We'll let everybody come back from break, and right at 2:20 my time. I'm not in Eastern time, but 1:20 your time, 10 afternoon Mountain time, 10 after 11 Pacific time. We got all the time zones covered today. I like your background, Daphne. You look like you're in a wintry wonderland.
I labeled it wishful thinking because it never, well, it did snow here a couple of weeks ago. It was amazing. Nobody
Yeah,
knew
you did
what to
get some
do.
snow in Texas. That's right.
I did think about putting some snow pictures in our presentation just to show that, yes, it really does snow here every now and then.
And
I
Melissa,
got about,
oh, I was just gonna say,
I was
Melissa,
going to say,
go ahead.
I was just going to say, I got about 5 or 6 inches at my house. Most of it melted on the pavement, but there were some spots in the yard, like a garden path, where it actually accumulated about 6 inches.
Wow. So I was just gonna say, please don't be alarmed. I'll be giving you a verbal 2-minute warning when you have 2 minutes left.
Okay.
Okay.
No worries.
All right. With that, I'm going to start giving some instructions as people are coming back into the room. Thank you, everyone. You have joined the Texas and Utah room for the breakout session, and we are going to have Texas up first. I'm just give everybody a reminder that we are going to use the comments, the chat box for comments and questions. So as you're listening to the presentations, which will go back to back, please record your questions and comments there, and then I'll moderate, and then we can have people turn on their microphones if we need some more detail or conversation for the presenters. With that, up first, we have Texas, and Melissa Fox will be presenting with Daphne Fulton as backup, but Daphne's voice is, I hear, a little weak today, so Melissa's going to take the lead. So with that, Melissa, I will turn it over to you and let you know when you have 2 minutes left.
Okay, thanks. I'm hearing lots of great ideas today. So I'll just jump right in here. We have some great team members. We've about doubled our size, our team size. And we have added 2 genetic students from Baylor College of Medicine in Houston. And here's kind of where we are. We're heavy in the Austin area. We have about 5 members, 3 in Houston. That includes our 2 new genetic students, 1 in Huntsville, 1 in Longview, Fort Worth, and El Paso. So you can see we're still missing folks from the Panhandle and from South Texas and pretty much anywhere along the Texas-Mexico border. So we are trying to reach out to all of the areas of the state. Panhandle and South Texas, pretty much anywhere west of, say, San Antonio and Fort Worth is considered to be a lot more rural. And we also are looking for more diversity within our team members as well. And we too are considering reaching out to tribal nations here in Texas. So lessons learned during the pandemic. Definitely it helps. I mean, losing my concentration. It definitely affects people going to get doctor's appointments, lab work, any kind of in-person kind of visits. But it also affected some of the areas like the Evenings with Genetics. It's a program some of you are familiar with, just an online informational session. Finding the right healthcare clinic, and research too. There was a research program or study just getting started at Baylor College of Medicine when the pandemic started, and a lot of that was in-person visits to do lab work. And I know that kind of came to a screeching halt. I mean, they are kept going, but it's for people generally in the Houston area who are willing to, or people who are willing to travel. But it's also affected the team members too. We're all working from home. We all have distractions, as you all know. And it's just been difficult to keep your focus and keep going. Daphne, do you have anything you want to jump in with here?
We just had to be a lot more creative with the pandemic than we would have normally. Just trying to get things together, but it really has been difficult for a lot of our members because they're not working from home and they have kids at home or distractions at home and off. And since we're all volunteers, that's kind of difficult sometimes.
Right, definitely. So where we're going to do, we have found a lot of ways just to work our way into networks. And that's kind of where we're going to continue doing our outreach, is working our way into networks and associations, Texas Pediatric Society, Texas Genetic Nursing, any kind of like Texas Rural Health Association. We're going to work with them to see if we can get Mountain States tools in there. And we're also revamping our team page to make it a little more user-friendly, make it more aesthetically pleasing and kind of divide it into parent resources and professional resources and give it a little more in-depth, I'm sorry, my concentration is totally off now. Give a little more in-depth presentation, just visual presentation, make it a little more user-friendly. I crossed out considering on our last meeting. We have decided. What's that?
2 minutes.
2 minutes.
Oh, okay. We are going to hire a grad student to do research for us. You know, we can direct them to associations or organizations that we would like to contact, but they will search out who at that organization to contact and work with them. And that way they'll have the same dialogue every time, the same script to work with. Okay. Sorry. And okay. And our first clinic is Cook's Children's Pediatrics at Lake Worth, and Dr. Christina Sherrod, who has worked in rural health and is now in the DFW area. She will be our lead person there. So, questions?
Perfect. Thank you, Melissa. We're actually not going to take questions right now. We're going to switch over to Utah. So if you can stop sharing your screen, and Heidi or Chuck, if you could go ahead and pull your screen up, and we'll go ahead and get started with Utah.
All right, can you see my screen?
Yep, I can, and I can hear you.
Yeah.
Thanks, Heidi.
Okay, great. So now my screen, there you go. We've added 3 new members to our team since a year ago. Lara Duca is with University of Utah and ARUP Laboratories. We're excited because she is born in Ecuador and a native Spanish speaker. So she's already been helping us with translating some materials. And she's a dog mom and has training in pediatrics and medical genetics in St. Louis, as well as medical biochemical genetics in Pittsburgh. And we've also added another patient advocate, Janelle Preston. She has a long history in special education. She is the Act Early ambassador for Utah for the CDC. And she works in up to 3 early intervention. So her experience is going to be another great asset to our community. And then also Melissa Goins from Utah Newborn Screening. She's joined us, and she has a different background as well that's helping us diversify. She is a pediatrician and pediatric intensivist. So previously, we had developed a developmental delay algorithm, and like was mentioned before, we distributed that to a few pediatrician clinics where we trained them and they implemented it. And we even had some genetic testing ordered, and kids receive diagnoses from the program. But we are not abandoning that. We are expanding that now in the new grant cycle, and we're expanding in a way to focus a little more on the low-income families in our community, in our state. And we're doing this by focusing on rural locations and making sure that we have a Spanish-speaking focus in our materials as well. And like I said, Laura translated our developmental delay algorithm into Spanish. And now our big approach of how to do this, how to reach out to the rural and the lower income communities, is we have a book that is put out by the CDC, part of the program that Janelle works with, Learn the Signs. And it's called Where is Bear? And it's a cute little book all about Bear and what he does. And it's almost a trick to get families to read this book with their kids, and it gets them thinking about, am I meeting the milestones? So, you know, our developmental delay algorithm, we were reaching out to clinicians. Now we're reaching out directly to families with this book that we have permission to reproduce. And this is where we're going to spend our funding, is printing this book. And on the back of the book is an area where we'll have our little QR code that will lead the families back to our webpage. We figured the QR code was a great way to get to everyone, because everyone of all income levels seem to have a smartphone these days. And then we'll curate more what the materials are on our landing page and where we take them from there. But we think this is a fun way for families to like sit in a waiting room and go, oh, there's a freebie, you know, I'll take it. And we hope to get it in a lot of hands. And we also hope that this approach is going to be a great way to get some data back to Liza and count what is our outreach, what are we accomplishing here. So like I said, we'll have the landing page, and we'll have the Where is Bear downloadable there as well. So if they want to download it and print it out or send it to someone else and share it, and we'll have the algorithm, and then we'll have more resources. And the way we are going to get this out is we're going to distribute it through community clinics, early intervention centers, through WIC, and through a program in Utah called the Rural and Underserved Utah Training Experience. So hopefully we can get it to spread across our state. So our experiences as a team, we're excited to expand our team and have more voices and more support. And we're excited that we're also building upon the previous grant cycle. And so we just feel like it's expanding and growing, and what we've done in the past is not a loss. It's all building on itself. And of course, we're excited to have in-person meetings. Our first clinic for Time for Genetics is going to be with Dr. Maureen Kobabe, and she's the clinic lead. She's really excited about this, and we are also excited for some more diversity because she has Japanese and Spanish speaking abilities, and that will be wonderful. And I think we have 1.5 minutes, so I'm going to give a couple of shameless plugs.
Go ahead.
First is we'd love for you to check out the medical home portal. Chuck's group has been doing a lot of improvements there, and we just want to remind you of that wonderful resource. And then also I want to give some thanks to my team for a recent development in Utah. Utah Newborn Screening recently diagnosed the first baby through newborn screening with GAMP deficiency. And I have a close connection with this. I have 2 children with GAMP deficiency, and that's how I became involved with MSRGN. And actually, Dr. Lloyd, who is on our team and on this call, was the neurologist who was forward thinking and decided not only would he order an MRI for my daughter who was having seizures and delays, but also spectroscopy. And that's what started us off with our diagnosis of a creatine deficiency, where Dr. Longo finalized that diagnosis. And then Dr. Longo and Pasquale began researching, writing papers, and promoting GAMP newborn screening in Utah. And then Andy and Kim, of course, have taken that and run with it and have been screening for GAMP for 5 years. And now we've got our one true positive that the Acadunk group would like. And so we hope that this is going to be on the RESP soon, and just want to spread the word with all of you and thank my team.
Thank you so much, Heidi. Your screen was blank at the end. Were you sharing anything that you wanted us to see?
No.
Okay, just wanted to make sure. There was just a question. Thank you so much for your presentation. All right, so now we'd like to open it up for conversation and discussion and a Q&A for Texas and Utah. So if you can type those in the chat, or if you want to unmute and ask a question, you can do that as well. The question I have here is, there something on the screen? And Chuck answered that and said no, slides said ended. So that's our first conversation there. Let's see. Anybody have any questions? Heidi, do you want to talk about how you guys came to the decision to do the Where is Bear? I know you guys have had quite a few conversations that kind of landed you on that. Some discussions on how for families to have conversations with their pediatric providers and things like that. Do you want to share a little bit about that?
Like I said, at first we were thinking an app or a landing page or a pamphlet or this or that, and we just thought there's a lot of appeal with a cute book. It kind of sells itself. Us moms like freebies. It's a free cute book. And it also has, like I said, it's cute, it's fun, it's a toy, it's a game. It's not talk to your doctor about developmental delays. And I know when you have a 2-year-old or 1-year-old that you're starting to get worried about, those materials are scary almost and a little depressing, and you kind of want to avoid them in a way because it's a tough time right then. And so we thought that something like this is fun and appealing, and we could kind of sneak it into moms and dads thinking about this and considering it.
So I've gotten a chance to look at the book, and it's really done well because it has little prompts for families, right, to test milestones as you read it to your child. So it's really cool. Melissa and Daphne, do you want to share? I'll just give a reminder to everybody that the Texas team won the Frugal Fiddle Award at our last state team roundup at the end of the last grant cycle. Do you want to share some of your frugal ways of networking with some of the groups in Texas that you thought you were going to have to pay for using your state team funds and turned out to be a freebie?
Well, in Texas, we're all poor. No, we're real tight with our money. We knew we only had a little bit to spend. So, yeah, we are real frugal. It's really interesting when we get together. Well, do you think that'll cost that much? How much do you think this will cost? But yeah, we decided finally to get a graduate student to do research to reach clinics and to give them our information about genetic testing, genetic services, let her get an into the clinic world. And we're looking at FQHCs, federally qualified health centers, those type of things to really make a push for. Yeah, but we looked at a lot of things. And
I have a question. Will you be using your entire funding this year for the graduate student, or are you going to reserve some in case you have to pay for some type of partnerships or advertising or anything like that?
We actually discussed this. No, we're going to set $200 aside in case we have to pay something, but we don't want to pay for partnerships. We want people to give it to us. And really the only way that we're going to find that out is to just ask. I mean, what are they going to tell you? No. So we're going to just ask. We think that
they don't tell Texas no very often, do they? You ask.
Yeah. We just got to ask and build up those.
We have had. Go ahead, Daphne.
No, I just said just build up our relationships that we had. We even discussed going to work with the medical students, with the medical student organizations, to work with them. I know, like at Texas A&M, they've got a genetics, medical students interested in genetics. So we figured that'd be a really great place to do. Our medical school that at my particular university is fairly new, and the students are looking for projects like these.
Great, thank you. And we have a question for Heidi from Edie. Heidi, have you gotten any negative feedback from parents about the book or looking for developmental milestones?
We have not distributed it yet. So not yet. I hope not.
Stay tuned. Stay tuned for that. And Janet has a question also for Where is Bear. Could we use the Where is Bear in our Time for Genetics Clinics program? What is the cost for using more of this in the region? Is that in the region?
Yeah.
So I think you haven't gotten printing costs yet, right? And the printing is going to come from, because you're customizing it. These materials are available on the CDC's website for free, or they were the last time I looked. I put the 2 links there, and I have the link to order them. So that is definitely a great idea. Janet, I think the printing costs for Utah are because they want to reprint it using the QR code on the back. So that's not as is from the CDC.
And that will be another nice data point, is how many people use that QR code and hit that URL.
Yeah, I was just thinking about that when you're presenting, to have the landing page be separate from the Utah page on the website so that you have two different counts. I was thinking like Liza. So I did put the links to the English and Spanish version PDFs if anybody wants to see those in the comments, because there were a couple other comments about that. Robin had a comment, whereas historically some pediatricians have discounted concerns about a child's development. Is that still a concern, or how do you overcome that? Do we have Chuck as a pediatrician chime in on that? Go ahead, Heidi.
I was gonna say, I think that's why we're gonna be careful and focus on the other material that they will see when they use that QR code, and make the developmental delay algorithm available to the families. I know, it's maybe a little over their heads and not feeling super relevant, but they might see that and go, my kid, and print it out and take it with them and have a conversation with their doctor and say, I did this book and I think my kid's behind, and I also saw this algorithm, and according to this, I feel like we should have some testing, and give them a little support. Sorry, Chuck, do you have anything to?
No, I thought that was great. Better than I would have responded.
Yeah, and the other thing about the Learn the Signs Act Early, I know I've learned a ton about it over the last, probably the last year, because we included it in our pop-up material as when I first kind of came about some of their materials. But they have a whole suite of materials that goes around this book, right? It's not just the book. They have an app for parents to track milestones. They have monthly checklists, so 2 month, 4 months, 6 months, all well visit checklist on milestones. There's a lot of things that go around to support the family that the Utah State team won't have to develop, that are available too. All right, anybody else have some questions? We have about 6 minutes left before we teleport back into the main room. There were a couple questions earlier. Can you share where is Bear with the other states? So those links are there. Did I miss any? How about any other questions for Texas? Yep, Janet's got one.
Hi, this is Jan. So you made the comment that you were working, one of the things you're really focusing on is making connections with other groups like the AAP and the Texas Rural Health Association, and then providing resources. I guess my question is, what's your goal from the standpoint of resources? Are you going to try to just let them know about the genetic resources, or try to connect them to clinics, or what's sort of the end game there? What sort of resources are you providing?
Mostly we are connecting them with mountain states where we have resources listed for professionals and for families, and make it more comfortable for general practitioners, pediatricians, people who their main population is not someone who has a genetic diagnosis, make it more comfortable for them to discuss with families. Because a lot of physicians just want to, pass them on and say, oh, here, let me refer you to this other person. You're going to have to wait 6 months to 1.5 years to see. And that was before the pandemic.
And this is Christy. There's another question in the chat for Heidi. How are you letting pediatricians know you're distributing this to families?
Well, since we're a small group, we're going to start with the organizations I listed, like WIC and the early intervention groups, and then reach out and hope that rural group will help us with the distribution. So, we're not going to get to every single pediatrician, but we'll bundle those groups with a letter and contact information for our team members. So if they do get it and, go, what is this? They can contact us. We can explain it further. I think that's going to be our approach.
We can also reach out to the American Academy of Pediatrics chapter I'm sure they'd be happy to include it in their newsletter.
Yeah, we had hoped to share the algorithm with that group. It would be nice if we had in-person meetings again, and these books would be awesome to hand out there.
Really.
Great, thank you. And I'm just popping another link in the chat for the Learn the Science Act early materials. So the Utah team chose this book. The Bear book is for the 2-year-olds, but there's also a 1-year-old book and a 3-year-old book as well for milestones at 1 and 3. So if anybody's interested in that. All right, we have about 3 minutes remaining before we teleport out. So any other questions? Any other gasps anyone wants to share before they type it on the Padlet? We're nowhere close to 80 sticky notes yet, but I know they're coming.
Christy, I'm just happy that through these sessions, I've been seeing more resources in Spanish, and that's really good. I'm really happy with that. So there's more and more stuff translating to the Hispanic Latino community. So that's great.
It's really exciting, Maria, because I just linked it. I don't know if you saw, but I figured out how to do it on the drop down for families. We do have a Spanish page on our website now that I've been collecting all the Spanish resources for genetics. So
yes, and
that page has grown exponentially since our last grant cycle. So I agree with you. I think it's super exciting.
Yeah, I'm really excited. So it's gonna make it more easy to, kind of extend it to the community. So thanks everybody for your work. Appreciate it.
All right, and Lourdes said, really appreciate the Spanish translations also. And Cody reminds us that 6.98 million Spanish speakers in Texas alone. So, all righty.
I have a quick question.
Yeah, go ahead, Melissa.
I was going to ask, we would like to reach out to some of the tribal communities in Texas. And what is a good way to get your foot in the door to reach someone?
Are you addressing that to anyone in particular or just the group?
The group.
So do we have any one? I don't know if Utah has taken this on quite yet, adding tribal representation to your
We
group.
haven't, but I wonder if there's a group that interacts with the tribal groups in your state regularly. It's similar to what we're doing with the Root group, the Rural Urban Training Education Group.
I know Nevada is working on that right now, and they reached out to the Nevada Intertribal group for their state. So they have had a collaborative intertribal group that they had found contacts for, and we're working on that. Some other ideas that have come up with some of the other groups is finding a cultural liaison, so somebody from a tribal representation that might want to be a team member and then introduces you to other organizations. Sometimes also networking across. So we just had a team member that joined in New Mexico for tribal representation, and she works with tribes in Montana, and our Montana team is looking for tribal representation. So some of that cross state collaboration works as well.
And Laura just shared a link that looks promising.
Great. Tribal Leaders Directory. Thank you so much, Laura.
Yes, thank you.
All right, 6 seconds remaining. We're gonna teleport back. So you can leave your breakout room or you will be automatically teleported in 55 seconds.